So now we're going to be after your appointment with the patient. You've talked to them, you've taken notes, you've gotten all the information you needed. So now we're going to start charting on the appointment. So the first thing we're going to assume this is a new patient appointment to begin with. If you should need to do a mental status exam or an Ames check, if you see the patient in person, you can access those through here, My Caseload, Path Documents, and then I like Path Assessment Documents. Mental status exam is right here. You click on it. You can do one, and it just kind of asks all the questions. Now mark it all down. And you save that, sign it, and now it's done. Same thing if you wanted to do a Ames scale. You can do that here, same idea, add. That's the instructions, and this is the actual. You can just, again, click, 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 see where they're at, any problems, go through all the questions, any abnormal movements, submit. Oh, I guess you need to do all of them. I always forget that part. Okay. Oh, geez, Louise. This one. Okay. And again, you sign it. Everything you do, you're going to sign. Okay. So that's done. So now we're going to go back to this. Open the client chart, which you can always do when you go to that. You can go up here to where their name is. You can. That always brings you back to the chart. And now we're going to chart on the actual appointment. We're going to go through and do our note. So from the chart, you can do it one of two ways. I like to do it through my schedule. And so we're going to go back to the 14th. Was our appointment. So this is your schedule, and in real life, this would have a lot more appointments on it, but for this, we just have one appointment. So then you're going to go into this appointment, and you're going to status, you're going to click there where it says none. And here are your options. You could say the appointment was kept. If for some reason the patient canceled, or you needed to cancel your appointment with CBT is canceled by therapist, canceled by client. And if the patient doesn't show, this is how you mark it as do not show. But for us today, we're going to say kept. Then you confirm the time, and it's a new patient, so it's 75 minutes. But it took we took a little less time than we needed for this. So then we're going to submit and continue to document. If for some reason you weren't ready to document, you can always just hit submit, and that will save that part, and then you can go back and put the note in afterwards. But for now, we'll just go right to the note. So this is where you're selecting your note. It's going to be a new patient note or an established patient note. For now, we're going to do the new patient note. Submit. And submit is always, it just means it's just the same as save. So don't think like if you click it, it's submitted and you can't get it back. It's just the save indicator. So here's your note. Here's your new patient note. And this is basically the information. Most of your narrative is going to be in here. That's where you're going to list all the current problems, the history of the problem, any subjective data and objective data that you want to have in the note, you put it in there. Really, most of the information is going to be here. Then we go down further, do the family psychiatric history. You can click and put it, dad has anxiety down here if you wanted to. And here's where we're going to start talking on the diagnostic assessment. So basically it's asking, did you look at the diagnostic assessment and do you have anything to add to it? And you're going to say the diagnostic assessment date was July 1st or whenever it was. And then if you have something to add, you have nothing to add, you can click here. If here you have something to add based on medications, you could say additional medications indicated below. You can list the medications here, rationale, dosage, frequency, etc. Any side effects, any adverse drug reactions or allergies on the current medications. And then we just go through and any additional psychiatric history, something that isn't in the DA that in your conversation with the patient, that you think is important and needs to be added to the history. So this is where you would add it. If there's nothing to add, you could just say no additional history needed. Same thing with health history. You're going to put down the date of the health history that you looked at. And this is, again, saying, I looked at it and I agree with everything's on there. There's nothing missing. And this is where you're going to document that you did do a mental status exam, which you always do for new patients. Here's where you put in the diagnosis. And that could be, you know, you want to put in the code with the and then your justification, you're going to take that from the DA and you just take the explanations from the DA and you can just put it right in here. Medications, if none are prescribed, you just say none prescribed. And other here, you can just put in the medications, the dosage, the route, the frequency, and the amount. You could put it here. If you don't put it here, though, just so you know, it automatically populates from Dr. First. So it will populate not into this box, but when you do your final report, it will be on at the end of your report. So you can add it here, but it'll also be added once your report is signed and completed. And did you explain the rationale? Only if there's new medications or changes. And then you say who you talk to, the client or the guardian, agrees with medication, understands information, or vice versa if they for some reason don't want medications. Over here, we'll put in your laboratory test order. Sometimes you'll get an EKG or you'll get a CBC or liver panels. Whatever you put in there is where you know, whatever you want is where you put it in there. And then here's going to be your follow-up plan. And that's where you're going to discuss like what's the next step. So we're going to talk again, you know, in 4 weeks or 2 weeks, and we're going to, you know, refer them out to the Flexman Clinic to be evaluated for autism. You know, there's whatever that follow-up that's going to be required is where you put that. If you for some reason need an interpreter, you put that there. And then you agree to an attestation, just basically saying that what you wrote in there is accurate and were provided, and that's everything that you documented is accurate. So then you say, I agree, and then you submit. You need something, it won't let you sign it unless there's something in there. So you just put something in there. But in the real world, you'd have plenty in there. And this is where the medications would be. If we had ordered meds, they would be listed here. And you don't have to do anything to them. You just literally just look at them, make sure they're accurate, which they should be because they came right from this prescribing software. And then you just hit submit from there. And then additional services. And this is here where you would pick new patient or established patient. And you say new patient. And by time, that's how we bill through time. And this just make sure these numbers are correct. Sometimes if you accidentally do AM or PM, you might get a really wonky number there, you know, 765 minutes. And then that just tells you that you have to just go back and change the appointment to make sure the times are accurate. And then once you're here, all that information is correct, you hit submit. And here's your signature. So again, this is where it'll just automatically populate for you. I'm not sure if in this training module, if it has the correct signatures, but that's what you would sign it and submit here, and then it would be signed. If this was a chart that you wanted to send to your collaborator, you would click here and choose who you want to send it to, and then it would go to that next person to sign before it gets approved. So then we're going to submit, and it didn't take the signature because it's not accurate, but in the active site, it would take that signature. So that would be how you would sign off on. And once you signed it, it would say signed here. Where it says yes, it would say yes dash signed if the signature went through. But in this training module, it doesn't really quite go through. So just pretend. So that's how we do a new patient. So next, we're going to do an established patient. So now we're going to review an established patient appointment. So again, this is from our schedule. Just like the other one, we're going to click on the status. And we're going to say kept, assuming we kept it. If we needed to change it, we could change it. And then submit and continue to document. And this time I'm going to do established patient note. So you can see this is less information in this note, but it's just kind of an updates. Here's where, again, the majority of your narrative is going to be up here. And you're going to talk about the condition, any medications, changes, any reactions, the effectiveness of the medications, any medical healthcare changes since the last time you saw the patient, and just how they're doing since the last time you spoke to them. Check vitals. If you didn't, you just say no. And you could say it was a telephone visit or if it was a doxy visit. If they were in the office, you could say yes. And then you're fine. Summary of lab results. If you would order that EKG or CBC or the liver panel and you wanted to, this is where you put your results. And then here we would also say we share the results with a client. Now just keep in mind, even if you didn't do results, you put none reported up here. You still need to answer this question even if there were no results. It's just a little wonky piece about CareLogic. Same thing with Ames check. If you didn't need to do it, you can just say not updated. But you have to say something or not applicable, and this would be, if there are antipsychotics or involuntary movements was a concern. This is where the medications are. These, again, the medications that you prescribe for them. You can either put it in here on your own, or like I said earlier, the medications will automatically populate to the report after you sign the note. So you can put them here, or you can just skip it or say, see next page, see below, because that's where they're going to be in the report. Any other comments or rationale on medications? Sometimes I'll put the diagnosis in here just to say, hey, this is why I gave them this medication, is because, they're depression. They have depression. MAP client, no, again, you have to answer that one. If you don't answer that one, they don't like you. But so you have to give them an answer there. And then again, explain rationale, just like the other note. If it's new or changed, you just answer that then. If nothing's changed, if the dosing is going to stay the same, you don't have to answer that at all. And then again, client agrees, understands. Any interventions you did, you could talk about, what you talked to them about, their health and exercise and diet and all the other things you talk to them about besides the medications. Other things that can support their treatment, any lab tests that we talked about, any other concerns that you have for them. This is where you put that information in. And then the follow-up plan will be what's going to happen next. And this might be, we might be ordering more labs because we might have some concerns that we want to test for something else. We're going to talk about when we're going to see them again. We're going to say in 2 weeks or 4 weeks or 3 weeks, whatever that is, you put that in here. And any other follow-ups, referrals, anything like that, this is where you would put that information. Update the aims, not necessary. Change in diagnosis. If you change the diagnosis, if you want to alter what the therapist has done, you can, but you need to update the DA and the service plan. And this is where you would do that. Well, that's where you would document why you changed the diagnosis. I don't typically do that because the therapist, I usually just talk to the therapist and you work something out between the two of you. Again, services for deaf, yes or no. And then I agree and submit, and it'll probably get, yeah, it needs something in the pink tells you that it needs something in there. Just to let you sign it. And then like it was before, this is where the medications would be. And you just submit through that, make sure it's accurate. And then this is where you're going to talk about what kind of appointment it was. It's an established patient by time, the basic time of your appointment. Always eyeball that, like I said before. Submit, and then sign it. And again, if you want me to send it to your collaborator, you could do it here, or you could just sign it from here. Doesn't have my signature on file, so it's not going to show up as signed. But basically, that's how you charge for an established patient.